The member for Macquarie has a call.
Thank you, Deputy Speaker. And I want to thank the member for Reid as chair of the committee for her work, and other committee members and the Secretariat in producing this interim report on mental health and suicide prevention in a very short time frame. Look, I think this has been a challenging committee because of the time frame, but we have had the benefit of many reports that have been written prior to our meeting. The Productivity Commission inquiry, the National Suicide Prevention Officer's report, the Victorian Royal Commission and the National Mental Health Workforce Strategy, and they have informed the place that we've reached in the interim report. And of course, we have had the opportunity to take into account the 2019 bushfires, which hit my local community so badly, as well as the COVID-19 pandemic. I think we all recognise the needs for improved mental health services were evident well before we went through bushfires in my community, followed by flood, then COVID, and then another massive flood in March, which is going to have long-tail mental health impacts. So we knew there was a need, and there are important issues raised in this report, one of which is around the affordability, and the committee considers this to be a significant and ongoing barrier to accessing mental health services in Australia. And I just want to give an example from my own community. I have young people who limit their psychology or psychiatry appointments because they have to pay up to a $200 gap fee each time, or they just miss out altogether and don't even start their treatment. I have parents who don't have private health insurance and can't afford the residential programs, the private residential programs for their kids who are suffering eating disorders. And they really consider themselves at the mercy of an under-resourced public health system. And these are some of the issues as a committee that we have taken evidence on. Just last week, I spoke to a mum whose daughter has an eating disorder, and the very best advice that they can get from any doctor anywhere in Sydney is to go to England for treatment. Now, that's the state of services available to people in not just Western Sydney, but in Sydney. And we know as a committee that we need to improve these things. And I know as a committee we will do our best to provide good advice. But as good as our reports might be, what we need is probably not just this report or more reports, but those reports to be actioned. What's needed is services on the ground, and certainly in the Blue Mountains and the Hawkesbury, we do need specialist services accessible to people, young people, old people, anxious people, psychotic people, people with complex mental health needs, and those needing early intervention. And what's needed is more capacity for the Blue Mountains satellite headspace, for example, which since it opened has had 80% of its clients reporting suicide ideation. And I've been very grateful to my local services for providing submissions to this committee for the second stage of our reporting. And I think my engagement in the committee shows I am extremely motivated to be involved in any useful decision-making process about where investment in mental health services should go. And I obviously welcome any investment in additional services. But I do stand here today asking a question that the people of the Hawkesbury are asking, which is why are we still waiting? In the Hawkesbury, why are we still waiting for a headspace? The last budget had funding for extra headspaces and we didn't get one. The young people have been waiting and waiting. Their parents have been waiting and waiting. Their teachers have been waiting and waiting. And I think that urgency, the need for it, comes through in our report, that we really do feel that these reports need to be actioned. What we really need in the Hawkesbury is a key coordinating place with a no wrong door policy for young people to walk in and say to someone who'll understand, I need help. So in lieu of those things happening, and as a committee we've been encouraged to invite our grassroots community organisations to make submissions to this inquiry, I've actually had the opportunity to work with a group of young people right at the grassroots. And they've been doing amazing work to develop their own way of reaching out to their peers to get them to talk about their battles with mental health, partly addressing the issue that we've raised in this report around stigma, one of the key themes that comes through. And I look forward to helping them launch their initiative in coming weeks. It will partly tackle the stigma associated with mental ill health and partly direct people to digital and phone support services, both of which are themes of this report. Everyone of the reports our committee has considered stresses early intervention, as the Chair has said, tackling issues when they first appear as a much more effective approach than letting them be ignored, untreated, so that they compound. The committee has had the benefit of being able to hear from very wise people, people who've spent a lot of time working through these issues, and certainly the Labor members value that expertise, and I'm pretty sure every committee member values that expertise. I'm not sure if any of the work that this committee has done or that the witnesses have done as part of the committee were addressed at all by funding that government's allocated in this year's budget, but I look forward to learning more about that. I do want to touch on one last point in our interim report, and that's around telehealth services. This report recognises just how useful an expansion of telehealth services and the take-up by consumers has been during COVID, and there's no doubt that it has saved lives. But if you live somewhere like the Macdonald Valley, which has faced flood and fire, where the landlines go down sometimes for weeks, where there's no mobile coverage, and the latency of the satellite via the NBN means it's not filling that gap, you can't actually access those services. So when we think about mental health as a committee, we can't see it in isolation. We need to make sure that the services that are available are accessible to everyone, one way or another, wherever they live. And I look forward to our committee finding a way to really add value to the work that the committed experts in the field are doing and have been doing for many years. And I thank them all for being involved with our committee, as they have been with so many other inquiries in the past. And I look forward to further work with a very dedicated team to get some action here.